Hey y'all, welcome to our YouTube channel. My name is Ansley and I'm an oncology nurse.
And my name is Luke and I am a junior nursing student in a BSN program.
And today we're going to talk about test-taking strategies.
Are a big part of nursing. They prepare you for taking the NCLEX, they gauge how much you know of the subject, and they're a good way of practicing, like actually getting ready for the NCLEX, which I already said.
But basically you need to say it twice because what's at the end of nursing school?
The NCLEX.
The NCLEX.
And that's what we're preparing you for all through nursing school. Yes, to be a nurse, but you can't be a nurse without first passing the NCLEX.
Yep. So what is our first test-taking strategy, Luke?
The first one, we've mentioned it in a previous video, is ABCs.
ABCs.
Airway, breathing, circulation.
Yes.
You need to analyze the question, see if it's addressing one of those areas, airway, breathing, or circulation, or all three, or two. And if it is, then you pick the one that goes with the highest. With the airway, breathing, circulation, pick the one that goes with the first one in the list. So if it's airway, pick airway. If the first one is breathing, pick breathing. If the first one is circulation. So like if your question only has circulation and breathing, which one do you pick?
Circulation.
No.
Breathing.
You fail. You pick breathing. Because if you don't have breathing and you don't have an airway, then you're not going to even have oxygen for the circulation to even happen. So
an example question of this would be like, you come on the scene of someone who just experienced full thickness burns and has lost their left arm and has profuse drainage coming from their mouth. What is the first problem you address?
The drainage coming out of their mouth, because that's blocking their airway.
They can't breathe.
They can't breathe.
They do have some major other problems going on that are going to have to be addressed very soon. But if they can't breathe, not breathing is going to kill them before. Yeah. But if they can breathe and they're missing their arm and that's bleeding, you got to stop the bleeding first. Because if you don't stop the bleeding, they're going to stop the breathing.
Exactly.
So, next test-taking strategy is Maslow's hierarchy of needs.
This is a big one. It's that triangle with like all the multicolor levels.
All the needs.
All the needs. You probably learned it in psychology. We do it a lot in nursing school. It starts off with like physiological needs, and at the very top is self-actualization. So the way you use that for taking a test is by seeing how the answers match up with a level on the Maslow's hierarchy of needs. The correct answer will be the one that's the lowest on the hierarchy of needs, most of the time.
Yeah, that sounds kind of weird because you said lowest on the hierarchy of needs, but that's like
on the triangle.
Yeah.
Yeah.
On the bottom of the triangle is the most important.
Most important. So that's your physiological needs.
If you don't have those met, you're not going to be able to meet the next one. So a question to do with that would be like one that addresses, say you have a patient come in and they have not eaten or drank anything for 3 days, and they are also saying that they have an infected scratch on their leg. Which are you going to address first? You're probably going to address the hydration first because that is the most pressing need because they need food and water.
Or say someone is coming in and they're saying that they're really depressed and that they are like have a low view of themselves, but they also are struggling with managing their type 1 diabetes. Which problem are you going to address first, or will be the most important to address? While the depression and the low self-esteem is very important to address, it's higher on that hierarchy of needs, and you need to meet the physiological needs of managing that type 1 diabetes first.
So most of the questions you're going to have are going to be between physiological needs or psychological needs, and which one you have to fill first. It's always, I don't want to say always, but
you can't say always.
Most of the 99% of the time, it's a physiological need first.
That goes to another tip. If an answer says always or implies that something always happens or never happens, if it's dealing in absolutes, that's most likely not the right
Most
answer.
likely.
But we can't say always not the right answer.
Or else it wouldn't be the right answer.
Exactly. Okay, another one is urgent versus non-urgent. This one seems pretty self-explanatory.
Yeah, and it kind of is.
Yeah.
If something is an urgent need versus a non-urgent need, that the confusing part comes into play when you are like, well, is this an urgent need? Is it not an urgent need? And a lot of times, at least for me, if I needed to question if it was an urgent need, it wasn't an urgent need.
Yeah. And
so usually you can see.
An example like that would be patient in room 2 is asking for a drink of water. Patient in room 3 is asking for the linens to be changed. And patient in room 4 is complaining of a 9 out of 10 pain in their chest. And so which one would be the most urgent? It would be the 9 out of 10 pain in their chest. Because that could be a myocardial infarction. It could be some other issue is really big. So,
so that's urgent versus non-urgent.
Yeah.
Then you have acute versus chronic, which is related to the urgent versus non-urgent.
Yeah.
So that is like if you have an acute issue or a chronic issue. So if we're talking about chest pain, if someone comes in and they have been coming to the doctor for chest pain, and usually they just have chest pain, they sit down and it goes away, and then it comes back, blah, blah. And then you have someone come in and say that they're young, and then they're saying, I'm having 8 out of 10 chest pain and some shortness of breath. Which chest pain are you going to address first? You're going to address the acute one, the one that is newest, because a new onset means something is suddenly not right going on with the body.
Yeah, or something
and
has changed.
Usually chronic, okay, we kind of already know what's going on, and we kind of already know how to treat it. And their body's kind of adapted to this problem going on.
And it may not progress, whereas the acute one may progress to worse things.
Yeah, it's usually something urgent.
Right.
Another confusing one is like with a COPD person, their oxygen level often is in the low 90s and even like 89, 88%.
Yeah.
And that's kind of their normal. And so you're going to have a question that addresses oxygen percentages and be like, this person has COPD and their oxygen is 88% and they're on 2 liters. And then you're going to have a patient in the other room where their oxygen is 89% and they're on 2 liters, but they don't have COPD.
Which one is more
urgent?
Which
one are you going to see first? You're going to see the one who doesn't have COPD.
Right, with an acute condition. Another example, like the chest pain from the previous example, what it would be if 2 patients both complain of 8 out of 10 chest pain. One of them, like Ansley said, has been coming to the doctor with this 8 out of 10 chest pain for the past 7 months. The other one, it suddenly happened when they were at home. They called the ambulance and they're like, I need to come. Which one is more urgent? Which one is more important? Which one are you going to address first? Sudden. Correct.
And you got to look for those words that clue you in.
Yeah.
Sudden, new onset,
Keywords.
Acute. They may even say acute. And then you're like, this is a new problem. Probably got to do something about that.
Yeah.
So that is another one that you got to look at.
What's another strategy?
ADPI.
ADPI.
The nursing process.
The nursing process, also the clinical judgment model.
Apparently, so I just graduated in April and Luke is a junior, and so apparently it's changed a little.
Yeah, a little bit.
Since when I was literally just in school.
Yeah. So
you might say things that are a little different, but it basically equals the same.
It's basically the same thing. So typically the nursing process is ADPI, assessment, diagnosis, or analyzation of the data, and then planning, implementation, and evaluation. And each one of those steps, you can read about it online. They're very detailed on what it means for the nursing thought process. It's kind of a way to help nurses think through problems and deal with patient cases from beginning to end.
Yes.
The clinical judgment model is similar. It has things like noticing what's going on, and then the same aspects of reevaluating. And it's a very interrelated process, not as linear as ADPI, but...
and I didn't learn whatever he's talking about, so
yeah.
I literally have no idea.
Yeah, but my professors tell me that the NCLEX is moving more towards that direction, and nursing as a whole might be moving more towards that direction.
So I'm already out of date, and I just graduated.
Right, so that's one thing you need to stay on top of everything. But so if a question is saying that you need to assess, since that's the first step, assessment or noticing, you probably should go with that
Pick
answer.
the step that's assessment. So like
Right.
if you have a patient and you are taking their vital signs and there's one vital sign you don't have like an oxygen level, and then one of the answers says obtain oxygen reading, that's going to be the answer because you don't have all the information that you need to treat the patient. So always make sure your assessment part is done. Then if your assessment part is done, probably the next step is going to be the diagnosis or
analyzation
of the data. So you're going to look at what's going on with the patient and what do we think it is.
Yeah. I think it's analysis of the data.
And then whatever it is.
Okay.
I don't know.
Yeah.
And then add P.
Planning.
I feel like people get the planning and the implementation part confused. Sometimes.
Yeah, planning is like the patient will do this, and then implementation is like, okay, now we're actually doing this with the patient. So they're very similar.
Planning is like the goal part, where you're like, patient will
where you set the goals for the patient.
Implementation, 90% oxygen reading.
Implementation is when you're doing it with the patient, and then evaluation is when you look back and see if it was successful, if it wasn't successful, and what you may need to change. Mm-hmm. And you'll go back to that planning step.
This helps a lot with the questions that say, what should the nurse do next?
Yeah.
What is the next priority for the nurse? And you're going to say, okay, well, did we already have the assessment done? Okay, yeah, we already have the assessment done. Oh, I already know what's wrong with the patient. Okay, I'm looking for either a plan or implementation part. Okay, so what am I going to do next? Oh, his oxygen is reading low. I'm going to put oxygen on him. So that is my implementation or fixing the problem. And then if there's a question, okay, you've already put oxygen on the patient, and what are you going to do next? We're going to evaluate.
Yeah.
Did that help? Is he the same? So you'll get vital signs. That will probably be the answer for that question.
Yeah.
Mm-hmm.
Another test taking tip. As you're going through questions, make sure you pick your answer and stick with it. Unless so there have been some times where I should have picked and stick and sometimes where I definitely should not have. But I think overall, it's a good strategy to have where you go with your gut feeling, go with that answer, and then just click to the next question. Most nursing tests don't let you go back because the NCLEX doesn't let you go back.
It's one question at a time.
Right. So pick and stick. Just trust your gut. Mm-hmm. Move on to the next question.
Because even if you do get the questions wrong, the more you second guess yourself, the more questions you will get wrong.
Right.
And you can try that out. Try it out on your first test if you don't want to pick and stick. And then try it out on your second test, pick and stick. And then just see how you compare. Or just try it out on quizzes or something and pick and stick and just see how it compares for you, because it really, it changed a lot about how I take tests, and it made my grades go up a lot because I would pick the answer, stick with it, don't even think about the question I just did, go to the next question.
Yeah, and for me it was a little different in prereqs because I could go back to the question. So I would just star it and then go back and think really hard about it. But with nursing, you can't go back, and so you don't have time. So that threw me off for the first one or two sets of tests because I wasn't picking and sticking because that's not what I was used to. Mm-hmm. But you just kind of have to adapt and modify your test taking strategy from those prereqs into the new nursing style to get ready for the NCLEX style test.
And also for real life, because if you end up doing something for a patient, you can't undo it.
You can't go back and undo the action.
You got to be confident and you just got to do it.
Yeah.
And it's got to be the right answer.
Taking tests this way is building that, going with your gut instinct and making sure that gut instinct is right. And just acting professionally as a nurse and dealing with it on the spot in the moment.
Yeah, because you can't go back and think about it.
Yeah.
And fix it. You can learn from it though.
Right. What's our next test taking strategy?
Next test taking strategy. Let me see if I wrote anything else. So whenever excuse me, my joke. Whenever you are taking a test, you need to, one good strategy is read the question and don't look at the answers and try to think of the answer first. A lot of times when you read the question and then you look at the answers, you will confuse yourself about what you thought the answer was. And so if you're permitted to have a whiteboard or anything like that, you can write down what you think the answer is, or you just think of it in your head and then look at the answers and see if any of them go with the answer that you picked. If none of them do, don't freak out, but look for something that's similar to the answer that you thought of.
Yeah.
But that is another thing that really, really helps me is just read the question, don't look at the answer, and then be like, what do I think this question has to do with, and which prioritizing framework should I use? And then, okay, I think this is the answer. And then look, and then lo and behold, there was my answer.
Yeah.
So that one's a really good one.
Another one that goes with that is when you're reading the question, read it very carefully, because there may be a word that says not, or a word that
read it twice.
Read it twice. Make sure you're catching every word, because it could be that you're looking for the best answer, or it could be that you're looking for the worst answer.
Yes, because there's gonna be 2 answers that are correct.
Yeah.
They're just, like the majority of questions, 2 are correct, but 1 is the most correct.
Yeah, and sometimes it'll be 2 are correct and 2 are incorrect.
Mm-hmm.
And so you'll be at like...
Or sometimes 3 are correct.
Yeah.
And you just have to pick the correctest one.
Yeah. Who knows?
Probably.
Anyways, make sure you read those questions so carefully, because that got me on a couple questions when I first started taking these nursing exams. Because I was just like flying through and I'm like, click, 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 pick and stick, go, go, go.
Yeah, but you gotta read before you pick and stick.
You gotta read before you pick and stick.
Those little words, the way NCLEX is written and the way NCLEX similar questions are written, they have clues in the question.
Yeah.
So you have to be like an investigator and find those little words, the not, the always, the next, or most important, or initial action. Those action words, they clue you in to what your answer should be. Especially, I know one that gets missed, that's like an easy one, is what should the nurse assess for? Well, there's likely going to be one answer that is actually an assessment.
Yeah.
And so there's your answer there. You don't even have to know what they're asking, basically. You just look for what the assessment is, and there you go. That's the answer.
I've seen a lot like that. Mm-hmm. And the more practice questions you do, the more tests you take, the more familiar you'll get with these. So taking more practice questions to study for the exams, really, rather than reading over the textbooks again or going over your study guides again. Take practice questions on those areas. There's so many websites you can find, so many different resources. I'm sure your professors know of resources.
Yes, ask your professors. Like one of my professors, she had these NCLEX prep books. And even though I wasn't preparing for NCLEX, I was preparing for her test. I asked if I could borrow it because it had the categories, and then it had like 25 questions on that category. And so then I could just answer questions. Even if I didn't really know that much, I could answer questions, read the rationales, and then I did way better on her test after I started doing that.
Right. So, any other test-taking
strategies?
Test-taking strategies.
Safety. We forgot
Safety.
that one. Whatever is the safest option. If someone is standing up and they're dizzy and the question is sit them down next,
do it.
Sit them down.
Oh, another one. Very important. So the last strategy is least invasive to most invasive.
And an example of this would be catheter insertion. So for certain issues, you can insert a catheter, and for others, you can't. So like if someone is incontinent, you can't just insert a catheter because that's going to be the most invasive option to keeping them clean. We can use like an external catheter. We can check on them every hour and see if they need to use the bedpan. There's other interventions you can do before you jump to putting in a catheter. Right,
because when you're doing those most invasive options, you're putting the patient at risk of developing, like in the case of a catheter-associated urinary tract infection or COTI. Yeah. So, yes, remember that strategy. Very important.
Least invasive to most invasive. Pick the least invasive option first.
All right. Thanks for watching the video.
That's all we got for you. If you have any other suggestions of test-taking strategies, comment them down below. And then let us know if these worked for you or didn't work for you. So that way everyone will know in the future.
Yes. Good luck on your tests.
Pass them all. You'll do great.